Morning everyone. Today we'll be learning about the blood supply of the head and neck region. The vascular system of the body includes the arterial system, capillary network, and the venous drainage. The arterial system carries the oxygenated blood from the heart to the all other parts of the body, and venous drainage is the return of the deoxygenated blood from all over the parts of the body back to the heart. And capillary network is the connection between the arterial and the venous system, which helps in exchange of the blood. So coming to the blood supply of the head and neck region, it starts from the arch of the aorta. From there we have on the right side the brachiocephalic artery, which further divides into the right subclavian vein and the right common carotid artery. In other ways, on the left side there is no brachiocephalic artery. The left common carotid artery and left subclavian vein directly comes out from the arch of aorta. So the right brachiocephalic trunk will divide into right common carotid artery and right subclavian artery, and on the other side left common carotid artery and right common carotid artery will divide into internal carotid artery and external carotid artery. So these are the common carotid artery, external carotid artery, internal carotid artery. These are the major blood supply vessels of the head and neck region. So coming to the common carotid artery, it divides into uh, it divides into external carotid artery and internal carotid artery on the both the sides. So going in deep, common carotid artery origin is from left side, it is directly from the arch of aorta. On the right side it is the brachiocephalic trunk. Of course it enters the neck behind the sternoclavicular joint, right, and it runs within the carotid sheath. So relations are in the anterior, it is crossed by the superior belly of the omohyoid. So this is the superior belly of the omohyoid, and this is the inferior belly of the omohyoid. This is divided by the sternocleidomastoid muscle. This is the sternocleidomastoid, which divides the omohyoid into superior belly and the inferior belly. Below the omohyoid, the artery is covered by the sternocleidomastoid muscle, anterior jugular vein, sternohyoid, and the sternothyroid and the middle thyroid veins. So in the posterior aspects to the common carotid artery, we have the transverse process of the vertebrae from V8, C4 to C8, and vertebral artery. This is the vertebral artery. We will be coming to that artery in upcoming slides. On the medial side, we have the thyroid gland, larynx, pharynx, and trachea on the medial side, and so next, coming to the lateral side, we have the internal jugular vein. So we can see here that this is covered in the carotid sheath. It is the common carotid artery. This is the internal jugular vein, that is which we say it is on the lateral aspects, vagus nerve and ansa cervicalis sympathetic trunk. In the neck, each common carotid artery extends upward laterally within the carotid sheath to the level of the upper border of the lamina of the thyroid cartilage. Till that lamina of the thyroid cartilage, it is the common carotid artery. From there, where it divides into external carotid artery and internal carotid artery. The bifurcation takes place at the carotid triangle opposite to the disc between the C3 and the C4 vertebra. So in the carotid triangle, external carotid lies under the cover of the sternocleidomastoid. The above the carotid triangle, it lies deep to the substance of the parotid gland. The branches of the external carotid artery we will be learning in our next slides. The external carotid artery, which is the main arterial supply of the head and neck region. So we have 8 branches of the external carotid artery, 3 anterior branches. It goes like superior thyroid artery, first artery, lingual artery, and facial artery. Ascending pharyngeal artery, which is the medial artery, which runs medially, and we have 2 posterior arteries, which is occipital artery and posterior auricular artery. So the 2 terminal branches of the external carotid artery are maxillary artery and superficial temporal artery. So we will be learning about each of these arteries in detail in our upcoming. Coming to the superior thyroid artery, we have coming to the superior thyroid artery. It arises from the external carotid artery just below the level of the crater corner of the hyoid bone. So its origin is from the just below the level. It is important that it is just below the level of the crater corner of the hyoid bone. It runs downwards. This is the hyoid bone just below the corner, crater corner of the hyoid bone. It divides and it runs forward and parallel just superficial to the external laryngeal nerve. So here we have the external laryngeal nerve and the superior thyroid artery run close to each other but diverge slightly near the thyroid gland. So this nerve which we are seeing is the superior laryngeal nerve, which divides into internal laryngeal nerve and the external laryngeal nerve. The superior thyroid artery runs along the external laryngeal nerve in downward, and they say that it runs parallel to the external laryngeal nerve, and the thyroid artery are close to each other but diverge slightly near the thyroid gland. So they diverge slightly near the thyroid gland. This artery is coming towards like this, and there is a slight divergence between the nerve and the artery towards this gland. Its relation to the external laryngeal nerve is important to the surgeon during the thyroid surgery. The artery and the nerve are close to each other higher up but diverge slightly near the gland. To avoid injury to the nerve, the superficial thyroid artery is ligated as close as to the gland. We have five branches of the superior thyroid artery. So this is common carotid artery, this is external carotid artery, this is internal carotid artery. From external carotid artery, the first branch coming out is superior thyroid artery, just below the crater corner of the hyoid bone. That we all know. We have first thing which first branch which is running infrahyoid branch. See, this is the hyoid. So this part running is infrahyoid branch, runs along the lower margin of the hyoid bone, and we have the superior laryngeal branch pierces the thyrohyoid membrane and enters the larynx. So we have the other branch, cricothyroid branch, runs across the cricothyroid membrane anastomosed with the arteries of the opposite side cricothyroid. And we have the arterial branches for the thyroid, and then we have the sternomastoid branch runs backward across the common carotid artery. So it supplies the sternocleidomastoid muscle. And so coming to the next artery, that is lingual artery. Lingual artery arises from the external carotid artery opposite to the tip of the greater corner of the hyoid bone. The superior thyroid artery was below the hyoid bone, and here we have uh, uh, lingual artery just opposite to the greater corner of the hyoid bone, that is at the level of the greater corner of the hyoid bone. Its course is divided into three parts by the hyoglossus muscle. The first part lies in the carotid triangle. Second part lies deep to the hyoglossus muscle along the upper border of the hyoid bone, and we have the third part which is entering into the uh, tongue part. So this is the uh, lingual artery. The first part is in the carotid triangle, and second part is below the hyoglossus muscle, and the third part which ascends upward back and enters into the tongue. So we'll be going in detail of all these branches. The third part is called arteria profunda linguae, or the deep lingual artery. It runs upward along the anterior border of the hyoglossus to enter the tongue. In its vertical course, it lies between the genioglossus medially and inferior longitudinal muscle of the tongue, laterally. So on the medial side we have genioclasses, and the lateral side we have the longitudinal muscles of the tongue. The horizontal part of the artery is accompanied by the lingual nerve. So horizontal part of the artery is accompanied by the lingual nerve. The supply it supplies the tongue and floor of the mouth. During the surgical remove of the tongue, the first part of the artery is ligated before it gives any branches to the tongue or the tonsils. So the branches of the lingual artery goes like suprahyoid branch, dorsal lingual branch, and the sublingual branch. So it is a suprahyoid branch is small, uh, runs along the upper border of the hyoid bone to anastomose with the contralateral side. So we have here the first branch of the lingual artery, that is suprahyoid branch, runs along the upper border of the hyoid bone and superficial to the hyoglossus muscle. The second branch is sublingual branch, which supplies the sublingual gland and adjoining structures. The third part is dorsal lingual branch. So here is the tongue. Dorsal lingual branch. It supplies the sublingual gland, mylohyoid muscles, and buccal and the gingival mucous membrane. Passes dorsally deep into the hyoglossus to supply the tongue, tonsils, soft palate, and the epiglottis region. So, coming to the facial artery. The facial artery arises from the external carotid artery just above the tip of the greater corner of the hyoid bone. So, superior thyroid artery arises from the below the level of the greater corner of the hyoid bone. Lingual artery arises at the greater corner of the hyoid bone, and facial artery arises from the above, just above the tip of the greater corner of the hyoid bone. It runs upward in the neck as a cervical part, and then on the face as the facial part. So we have here facial part as well as the cervical part in the neck. The tortuosity of the artery in the neck allows for the free movement of the pharynx during the deglutition. On the face, it allows the free movement of the mandible, the lip, and cheeks during mastication of the various facial expressions. Coming to the cervical course of the facial artery, it from its origin, it runs upward and forwards and enter the submandibular triangle. Turn sharply laterally uh, to be situated either in the grooves of the gland or within the substance. A sharp curve is covered by the angle of the mandible. This is the first turn of the facial artery. So then the horizontal part is directed anteriorly, laterally, and downwards to the lower border of the mandible to reach the anterior border of the masseter muscle. So here to the mandible, this is the mandible, and to it the to it the masseter muscle is attached. So it uh, goes and turns around the um, um, it turns around the gland, submandibular gland, and covers the lower border of the mandible along the anterior border of the masseter. It ascends upwards. The artery takes the second sharp turn around the mandibular border and enter into the face. So we should be learning about the ligation of the facial artery, as it is important in cases of the bleeding situations. Injury to the facial artery takes place during the operative procedures of the lower premolars and the molars if the instrument enters the cheek in this region. Also during the draining of the buccal abscess, deep incisions and damage to the facial artery. Care should be taken and the incision is given downwards and inwards instead of the straight downward. The blade should never penetrate the lateral inferior wall of the abscess. The facial artery can be located where it crosses the lower border of the mandible, anterior to the attachment of the masseter. The incision is made half an inch below the border of the mandible. Skin, platysma, and deep fascia are cut, and the soft tissue are bluntly dissected, and facial artery is palpated. It then isolated and tied and cut. So, coming to the cervical part of the facial artery, we have ascending palatine artery, tonsillar branch, submental branch, and the glandular branch. So we have ascending palatine, tonsillar branch, submental branch, and glandular branch for submandibular salivary gland and the lymph nodes. It supplies the pharynx, soft palate, auditory tube, and submandibular salivary gland. Coming to the facial part, we have various branches like the this is the facial artery, which is tortuous in its course, and its first branch is inferior label artery, superior label artery, and coming to the lateral nasal artery, and it again ascends as the uh, supratrochlear artery and supraorbital artery. The terminal branches gives like supratrochlear and the supraorbital branches. It supplies muscles and skins of the face. So these are the cervical part, ascending palatine, tonsillar, submental, and glandular, which supplies the tonsil of the root and the tongue. Tonsillar supplies the tonsils, and submental a large artery of the submental triangle and sublingual salivary gland. Glandular supplies the submandibular salivary gland and the lymph node. Submental supplies the sublingual salivary gland. Glandular branch supplies the submandibular salivary gland. So coming to the facial part, we have the inferior label, which supplies the inferior label glands, mucous membrane, and the muscles of the lower lip. Superior label supplies the upper lip. Lateral nasal supplies the nasalis muscle. Angular arteries is the terminal branch which gives off the supratrochlear and the supraorbital branches. Coming to the occipital artery, it arises from the, it is also one of the branches of the external carotid artery, posterior branches of the external carotid artery. It arises from the posterior aspect of the external carotid artery and runs upward along the lower border of the posterior belly of the trigastric muscle. Along the lower border of the posterior belly of the digastric muscle. Um, then it runs deep to the mastoid process and the muscles attached to it. So it gives the branches like it gives two branches to the sternocleidomastoid muscle and one meningeal branch and one mastoid branch. For sternocleidomastoid, two branches, meningeal branch one, mastoid branch one. It supplies the layers of the skull, sternocleidomastoid muscle, trapezius, deep muscles of the back, and dura mater of the posterior cranial fossa. So the branches of the occipital artery goes like sternocleidomastoid branch, mastoid branch, stylomastoid branch, auricular branch, muscular branch, descending branch, meningeal branch, and occipital branch. So coming to the next artery, that is posterior auricular artery. Its origin is retromandibular fossa above the styloid muscle. So of course it follows upper border of the styloid muscle and muscle, anterior border of the styloid process, and reaches the groove between the cartilage of the outer ear and the mastoid process. Distributes branches partly to the ear and partly to the scalp. So it gives the branches like stylomastoid artery, auricular branches, and the occipital branch. So it supplies the tympanic membrane, mastoid antrum, and the mastoid ear cells, in which the stylomastoid artery. Auricular branch supplies the scalp and both the surfaces of the auricle. Occipital branch supplies the occipital belly of the occipitofrontalis. So we'll be learning about what is occipitofrontal in other slides. So coming to the next artery, that is ascending pharyngeal artery, which runs medially. It arises from the lower end of the medial aspect of the external carotid artery. It runs vertically upward between the side walls of the middle ear and the auditory tube. It runs vertically between the side walls of the middle ear and the auditory tubes. Ascends to the base of the skull between the wall of the pharynx and the internal carotid artery. We have pharyngeal branch, tympanic branch, and the meningeal branches. So, pharyngeal branch supplies the wall of pharynx, tonsil, auditory tube, and the soft palate. Tympanic branch supplies the medial wall of the tympanic cavity. Meningeal branch supplies the dura mater of the brain. It passes upward between the styloglossus and the stylopharyngeus, crosses over the upper border of the superior constrictor. It supplies the tonsil, soft palate, and roof of the tongue. So, in the ascending pharyngeal artery, it is the smallest branch of all the branches. So, here will be, it is the same thing I have explained. So, it is the medially running. So, some branches are given up to the wall of the pharynx. Here for the pharynx, and some branches supply the prevertebral muscles, and the anastomose with the branches of the ascending cervical vertebral artery. We'll discuss about the vertebral artery later. So it anastomose with the ascending cervical and the vertebral arteries. Then the inferior tympanic branch supplies the middle ear. Even this supplies the middle ear. Some terminal meningeal branches pass through the foramen lacerum, the jugular foramen, and the hypoglossal canal. Through these canals and foramens, it enters the cranium and supplies the dura mater. What is that? Ascending pharyngeal artery. And it gives back the branch descends to the palate. It anastomoses with the ascending palatine branch of the facial artery. This is the ascending palatine artery of the facial artery. There is anastomosis between those two arteries. So coming to the one of the terminal branches of the superficial artery, the other terminal branch is maxillary artery. So the superficial temporal artery is the smallest terminal branch. It begins behind the neck of the mandible under cover of the parotid gland at about 5 centimeter above the zygoma. It divides into the anterior and the posterior branches which supplies the temple and the scalp region. So the anterior branch anastomose with the supraorbital and the supratrochlear branches of the ophthalmic artery. It also gives the branches like the transverse facial artery, middle temporal artery. Transverse facial artery is a branch of superficial temporal artery. Just facial artery is a branch of external carotid artery. So going to the next slide, the branches goes like superficial branches. We have zygomatico orbital artery, zygomatico temporal artery, and deep branches goes like middle temporal artery. Terminal branches divides above the zygomatic arch as the parietal branch and frontal branch. According to the name, they supplies the parietal region and the frontal region of the skull. Going to the last artery of the external carotid artery, that is maxillary artery. It is the larger terminal branch of the external carotid artery. Begins behind the neck of the mandible under the cover of the parotid gland. It runs forward deep to the neck of the mandible below the auriculotemporal nerve and enter the infratemporal fossa. So it has a wide territory of distribution and supplies. It supplies the muscles of the temporal and infratemporal region, dura mater, external and middle ear and the auditory tube, palate and root of the pharynx, nose and paranasal ear sinuses, upper and the lower jaws. So learning about the maxillary artery is important. So coming to the, we have three parts in maxillary artery, which is divided into mandibular part, pterygoid part, and pterygopalatine part. This is the first part, second part, and third part. It goes like in first part, it gives the five branches: deep auricular branch, anterior tympanic branch, middle meningeal branch, accessory meningeal branch, inferior alveolar branch. So you can remember it as D, A, M, A, I. The first letters of these branches goes like D, A, M, A, I. So deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar artery. So coming to the pterygoid part, it it goes like it gives the branches like deep temporal artery, pterygoid branches, mesenteric artery, and buccal artery. The way to remember all these arteries of the second part of the maxillary artery is like it supplies all the branches of the muscles of mastication. Deep temporal is muscle. Pterygoid branches which supplies the medial and lateral pterygoid muscles. Mesenteric branch artery which supplies the mesenteric muscle, and buccal artery which supplies the buccinator muscle. So coming back to the third part of the maxillary artery, that is pterygopalatine artery. So this gives the six branches which goes like posterior superior alveolar artery, infraorbital artery, greater palatine artery, pharyngeal artery, artery to pterygoid canal, and spinopalatine artery. The ways to remember this is the first letters which goes like P, I, G, P, A, S. So it goes like pig, P, I, G, P, A, S. So it goes like six branches will be pig pass. So posterior superior alveolar artery, infraorbital artery, greater palatine artery, pharyngeal artery, artery to pterygoid canal, spinopalatine artery. It is important to remember in this order as it will be the first branch, second branch. These branches are in order, so it will be easy to remember that pig pass is the mnemonic, and we can remember the arteries this way. And second part is muscles of mastication, and the first part is DAMAI. So we will try to remember the arteries in the first, second, and third part of the maxillary artery. Coming to the course and relation, maxillary artery is divided into three parts. The first part, we have mandibular part, runs forward first between the neck of the mandible and spinomandibular ligament below the auriculotemporal nerve and along the lower border of the lateral pterygoid. The second part, that is pterygoid part, it runs upward, forward, and superficial to the lower head of the lateral pterygoid. The third part, that is pterygopalatine part, passes between the two heads of the lateral pterygoid and enters the pterygopalatine fossa. So this first, second, and third parts of the maxillary artery are divided by the lateral pterygoid. So one below, before the lateral pterygoid is first part, and one superficial to the lateral pterygoid is second part. One after the lateral pterygoid is third part. So it runs between the two heads of the lateral pterygoid and enter the pterygopalatine fossa. We have seen the all the branches of the maxillary artery before. So if we are going in depth, we'll be seeing all the muscles, I mean all the arteries here. So here is the schematic diagram of all the arteries of the maxillary artery. So in first part we have deep auricular artery, then we go like D, accessory meningeal artery, middle meningeal artery, and anterior tympanic artery. Then we have inferior alveolar artery. Coming to the second part, which supplies the muscles of the mastication, deep temporal artery, pterygoid artery, mesenteric artery, and we have the buccal artery. Coming to the third part, we have the palatine artery, posterior superior alveolar artery, pharyngeal artery, infraorbital artery, spinopalatine artery, and artery to the pterygoid. Going in depth of the each branches of the maxillary artery. The first part, that is the mandibular part, is first branch given as deep auricular. It the foramen in the floor of the external acoustic meatus, and it supplies the skin of the external acoustic meatus, tympanic membrane, and temporomandibular joint. We have anterior tympanic, which exists from the pterygotympanic fissure, and it supplies the medial surface of the tympanic membrane. Middle meningeal artery, which enters the cranium through foramen spinosum. It supplies the meninges, fifth, seventh cranial nerve, and the middle ear and tensor tympani muscle. So coming to the accessory meningeal artery, it passes through the foramen oval and extracranial to the pterygoids. Inferior alveolar artery, it passes through the mandibular foramen. It supplies the lower teeth and the myloid muscle. So coming to the next slide. Uh, And second part, we have the mesenteric branch, which supplies the masseter, deep temporal branch, temporalis muscle, pterygoid branch, which supplies the lateral and the medial pterygoids, buccal branch, which supplies the skin of the cheek region. Coming to the pterygopalatine part, that is the third part of the maxillary artery. The first branch of the pterygopalatine part is posterior superior alveolar artery. It transmits from the alveolar canals in the body of the maxilla, alveolar canals, distribute the upper molars, premolars, and the maxillary sinus teeth. We have infraorbital artery, which comes out through the infraorbital fissure. It supplies the lower orbital muscles, lacrimal sac, maxillary sinus, upper incisor teeth, and canine and nose part. Greater palatine artery comes out through greater palatine canal. It supplies the soft palate, tonsil, palatine gland, and mucosa upper gums also. The ligation of the greater palatine artery. In case of heavy bleeding from the greater palatine artery, it should be managed. The damage during the minor surgical procedures during the incision of the abscess, care should be taken. That incision is made anterior posterior plane, not in the transverse plane. Incision should not be made near to the free margins of the gingiva. The direction of the edge of the knife should be upwards and outwards. If the artery is cut, it is almost impossible to stop hemorrhage via clamping of the artery or tamponades, and sometimes recourse has to be taken to ligation of the external carotid artery also. So coming to the three more branches of the third part, we have pharyngeal artery. Uh, Through it transmits through pharyngeal or the palato-vaginal canal. It supplies the roof of the nose and the pharynx, auditory tube, and sphenoidal sinus. Artery to pterygoid canal, it's passed through pterygoid canal. It supplies the auditory tube, upper pharynx, middle ear. Sphenopalatine artery, it transmits through sphenopalatine foramen and lateral. It supplies the lateral medial walls of the nose and paranasal air sinuses. Coming to the ligation of the external carotid artery, so the indication is uncontrolled hemorrhage in the injury of the superficial and deep parts of the faces. There are two approaches for the ligation of the external carotid artery. One is exposure in the carotid triangle and exposure in the retromandibular fossa. Exposure in the carotid triangle, incision is given at the level of the angle of the mandible, just behind the anterior border of the sternocleidomastoid, in which area the external carotid artery runs and is continued downward parallel to the to the border of the muscle to the level of the cricoid cartilage. After penetrating skin, platysma muscle and superficial sheath of the sternocleidomastoid is incised. Blunt dissection is done and the artery is explored by its first anterior branch, that is superior thyroid artery. Care is taken not to injure the hypoglossal nerve. So, exposure, the second method is exposure in the retromandibular fossa. It is also known as ligation of the external carotid artery at the stylomandibular ligament. The indication is hemorrhage from the maxillary artery. So this procedure is relatively simple compared to the carotid triangle. Skin is incised in the line at the tip of the mastoid process and circling the mandibular angle, continuing forward below the mandible. So skin and the posterior fibers of the platysma are breached and retromandibular vein is located, tied and cut. To this end, attachment of the parotid capsule to sternocleidomastoid must be severed with the scalpel. Flap of the soft tissues consisting of the skin and the parotid gland are retracted anteriorly and upwards. Immediately underneath the parotid gland, posterior belly of the digastric and the stylomandibular ligament is palpated. Further, lower jaw is pulled forward to widen the entrance of the retromandibular fossa, and submandibular ligament pulse of the external carotid artery is felt, which is isolated and tied in that region. So we'll be learning about the internal carotid artery in our upcoming slides. Thank you.